28-year-old Meera Bega, in a tribal forest village of Sarastol in the Achanakmar Wildlife Reserve of Chhattisgarh, was asleep when she was woken up at 4 am due to a feeling of unease. She kept tossing on her floor bed until she found her breathing to be difficult. It was then that she called her husband for help. He rushed to the house of Jivanti Bega, a health worker with the Jan Swasthya Sahyog some 100 meters away. By the time Jivanti Didi saw Meera in the light of dawn, she was struggling to breathe. Thinking it might be a poisonous snake bite leading to a paralysis of her muscles of respiration, Jivanti facilitated urgent hospitalization. Her perilous journey across a full river with an ambulance and doctor from JSS waiting at the other end was what finally helped her reach in time for intensive care and ventilation at the JSS hospital in village Ganyari. It was reassuring to her children and family that they could see her improving and was ready for being discharged on the 5th day. Snake and scorpion bites, severe infections, malaria, tuberculosis, acute abdominal conditions, stroke and cardiovascular events, pregnancy-related complications of obstructed labor, postpartum hemorrhage, eclampsia, and many other serious health problems plague the people of our rural and forest areas in central India. Poverty and undernutrition contribute to the huge burden of ill health. Access to even basic health care is a major challenge given the terrain in distant hamlets. Since the year 2000, when a group of public-spirited doctors from AIIMS Delhi decided to set base in Ganyari, the work of Jan Swasthya Sahyog has been a beacon of hope for these marginalized communities. With the aim of providing high-quality, low-cost, comprehensive health care as a continuum for the rural poor, the work of JSS has evolved into a model of a three-tiered community health program providing primary care in the broadest sense. The clinical service work is a major focus area, with trained women from the villages as health worker, a second tier of mid-level care providers at the JSS sub-centers in 3 village clusters, and the 100-bed referral hospital at village Ganyari. Intensive work in the community includes maternal and child health, non-communicable diseases and tuberculosis and malaria. Training of all cadres is an integral part and includes a school of nursing for tribal and Dalit girls, GNM and BSc, where free education is provided to them through a scheme of the Tribal Welfare Department. Doctors are trained in 2 broad postgraduate specialities that are the bedrock of rural health: family medicine and general surgery. The 100-bed referral hospital is like a mecca for the poor, where people are treated with empathy and dignity irrespective of their paying ability. Over 65,000 people are treated annually as outpatients, coming from 9 districts of Chhattisgarh and eastern Madhya Pradesh, catering to nearly 1.5 million population. Rational prescription is aided by an in-house public health laboratory, a generic pharmacy and imaging. Nearly 3,000 patients are treated as inpatients, a large number for high-quality surgical services ranging from cancer care to congenital malformations, infections to urinary stone disease, surgical emergencies and gynecological and obstetric care. Eye care and dental care are recent add-ons. Jan Swasthya Sahyog realized the importance of working on social determinants hand in hand with healthcare provision for the impoverished rural communities. They work on natural farming using the system of rice intensification and applying the same principles for wheat and millets, besides looking after the health of their animals and livestock, have helped communities. Local processing, value addition and packaging of local produce are being encouraged through a recently launched platform, Garima, which aims to make rural communities self-sufficient, healthy and thriving. Robust and well-functioning public health systems are the final and often only refuge for the rural poor. JSS has applied the lessons learned from their service work to strengthen them systematically since 2016. Through trainings, hand-holding, mentoring and supportive supervision, the focus has been on the quality of maternal and newborn care services in 6 districts of eastern Madhya Pradesh. This has been done in collaboration with the National Health Mission Madhya Pradesh and the National Health System Resource Center, New Delhi. Their pioneering work on sickle cell disease through community screening, diagnosis and management has spurred the state government to adopt a similar model across the state in the 27 high-burden districts. Another area of work for which JSS has been recognized is in the prevention of young child undernutrition through day-long rural creches. The Phulwaris, as these creches are called, provide not just for safekeeping and nutrition needs of these young children when both parents go to work, but also their mental development in a playway. Jan Swasthya Sahyog wishes to thank the rural and tribal communities with whom they have worked and learned, and the several supporters and well-wishers without whom this journey would not have been possible.